Hi, I'm Laurie Edmiston, outgoing Executive Director of CATIE, Canada's source for HIV and hepatitis C information.
And I'm Scott Elliott, Chair of CATIE's Board of Directors.
This will be my final annual report as I head off into retirement after 19 years at CATIE. I'm delighted to share with you the successes and the challenges that we've experienced in the last fiscal year.
And this is my first annual report as CATIE Board Chair, having assumed the role in 2021. While the Board of Directors is sad to see Laurie go, we are thankful for her contributions over the past 2 decades and for leaving the organization in good footing for new leadership.
Scott and I are delighted to share with you just some of the highlights of CATIE's work in the last fiscal year.
Canada's response to HIV and hepatitis C relies on people, organizations, and communities working together. Researchers, healthcare providers, educators, support workers, people living with HIV, people with lived experience of hepatitis C, and the communities most affected. But the reality is that not everyone is benefiting from each other's knowledge and expertise. Some of us are working in silos. Some of us don't get opportunities to meet or even speak with each other. Some of us have challenges accessing the latest science or understanding it in plain language. Some of us are lacking lived experience and the wisdom that offers to build programs and services that work. This is where CATIE comes in. As Canada's knowledge broker for HIV and hepatitis C, our job is to make connections. We attend conferences to learn about the latest science and emerging practices for programs, and we synthesize this knowledge for people working on the front lines. We offer free online courses on HIV and hepatitis C, both facilitated and self-directed, for people who provide health and social services. We create collaborative learning opportunities, such as interactive webinars and online dialogues, to foster interaction among researchers, service providers, and people with lived experience. We produce information resources for service providers, including news articles, treatment updates, analyses of emerging issues, case studies of effective programs, and more. This year, we launched our Harm Reduction Fundamentals Toolkit, a multimedia resource to build the capacity of service providers across Canada to better meet the health and support needs of people who use drugs through a harm reduction lens. We also produce information resources that service providers can share with their clients, brochures, magazines, leaflets, and web pages, and videos to be shared online and in waiting rooms. We make these resources available free of charge through our network of 102 publication stands in clinics and community-based organizations, and through the CATIE Ordering Centre, which distributed more than 550,000 print publications across Canada over the past year, an increase of 48% over the previous year. With the increased demand for online information and services during the COVID-19 pandemic, we revamped the CATIE website to be easier to navigate and more accessible. We also replaced HIV 411 and HCV 411 with Where To, a new and improved online directory of HIV, hepatitis C, sexual health and harm reduction services across Canada. The COVID-19 pandemic also prompted us to reimagine our awareness work with communities. We produced more educational videos than ever before, reached 37,000 followers through social media, sent nearly 300 email newsletters to nearly 14,000 subscribers, and we delivered 2 influencer marketing campaigns to share information about HIV and hepatitis C with the communities most affected, in the words of the communities most affected. On World AIDS Day and World Hepatitis Day, our editorials were published 30 times by 24 media outlets, reaching a combined circulation of 1.7 million readers. We also produced digital toolkits to provide images and videos for other organizations to raise awareness with their audiences, resulting in hundreds of downloads. We've been able to accomplish this thanks to the dedication of CATIE's staff team and the partners we work with across the country and internationally. We are also grateful to our board of directors for their leadership and strategic direction. CATIE's work over the past year has been made possible by the Public Health Agency of Canada, the Ontario Ministry of Health, Gilead Sciences Canada, and AbbVie, along with in-kind contributions from IMD, Chappelle, and Indigenous Link. We also thank those who made charitable donations, including a generous contribution this year from Shemin Mohammed Jr., founder of Let's Stop AIDS.
With this annual report marking the end of my tenure at CATIE, it's an opportunity to reflect back on how much progress we've made over the last 3 decades. Sometimes it's easy to forget, but 19 years ago when I started at CATIE, people living with HIV had to take multiple pills and continued to have common side effects. Now, with prompt diagnosis and treatment, people living with HIV can live long and healthy lives, and if they are undetectable, they are sexually untransmittable. Hepatitis C was still being treated with medications that had severe side effects and often didn't clear the virus. Direct-acting antivirals cure hepatitis C in more than 95% of people, and they're available around the country. Overdose prevention sites have opened up across the country, many with government approval and funding. That's a long way from the late 80s when I fought to establish the first needle syringe exchange program in Toronto. We still have a long way to go in addressing HIV, hepatitis C, and the burgeoning overdose crisis. But it's important to acknowledge how far we've come to understand how much we can accomplish together going forward. All of these achievements have been made possible by people like you. This type of collaboration is why CATIE exists, and we're proud to play a role in facilitating partnerships. As I head off into retirement, I'm confident that more accomplishments are yet to come, and I look forward to following them.